he was a very good baby. He was extremely good. You know what I mean? He'll wake up, have his, food, and then he'll just go back to sleep. You know, he was, that's what, we used to say that he was, such an angel.
Well, he's 4 years old now. He was developing quite normally up until the age of 2. He was talking, babbling on, and very social. And then all of a sudden, bang, something happened. He just became very withdrawn, speech stopped. He was just a changed little boy.
I don't think anyone, and I can say that myself because I don't have an autistic child, understands what it's like to live with an autistic child unless you have one. And you can sympathise and you can read every book in the world and you can watch programs, but to sit down at a table with someone when you say, I've had a difficult day, they know in context what a difficult day is.
And he went from being really lively and playing with my other son to nothing.
Giggling
really.
and just like a normal child, just a happy child, and just became sullen and sort of solemn.
Yeah, like he was just like, he wasn't there in spirit, he was just there in body.
Just like a shell.
There was times I honestly did not like her. I loved her to bits, but I just didn't like her. I just thought, what did I ever do to deserve this? I don't know is our life always going to be this difficult? Is it ever going to be any easier? Are we ever going to be able to go out in public? Are we ever going to be able to go out to dinner with our kids? And this man shouts at me across the sort of atrium of the shopping centre, for God's sake, why don't you give him a good whack? I guess my advice to parents would be, don't give up. Don't listen to your doctor if the reaction was too negative.
It's a different way of thinking, processing, relating to life. Yes, there are some drawbacks because the rest of the world isn't like us, and that makes it hard, but we can still contribute, we can still have so much to give that's of value. I want people to listen because I feel that if they understand autism, the kids needn't go through, and the adults with autism needn't go through some of the pain and the distress that they do go through, which is my experience too. I'm a trained educator. I'm not supposed to be because I've got autism. I'm not supposed to be able to be a social worker, but I have the social work qualification. It's just I can't work as part of a social work team. And typically, remember how you guys are not literal? Unless you trust people and believe somebody. In autism, we are very literal. So Mum takes Wendy to the doctor. The doctor says, hop up on the couch for a minute, Wendy, while I talk to Mum. All right, Doc, minute's up. Okay. And they just laugh at me and think I'm funny. But when I get quite cross because I've done what I've been told and the other people haven't. I feel lied to. I feel cheated, disappointed, and so on. When I was very, very small, and I thought everybody else was different. I didn't think it was me at all. I felt that it was everybody else, and I couldn't figure them out, and I was kind of waiting for them to become normal. I didn't like being closed in the house, and I'd always be getting out of the garden. I'd wander off to the ocean, so that was quite a worry for Mum. There were a couple of occasions when I was found on a sand dune, cut off from the rest of the shore by the incoming tide, and I hadn't noticed. I was very happy, focused on the waves. It has been a journey, And at times I didn't think I was going to make it. At times I didn't think I was going to survive. Whereas now I feel an enormous sense of feeling like I have a goal in life, something to contribute and do, which I really value. They see kids banging their heads, they see them having tantrums. Older people with autism get very distressed, they're pacing up and down and all these sorts of things. And it's seen as behaviour that needs to be modified rather than behaviour that needs to be understood.
We know one way or the other he will need support, that's for sure. You know, we can see that. But how much support and what it is, it's hard to say, because he's only 8 years old now, so he's got a long way to go.
Very affectionate with you both, isn't he?
Yeah, he is. Yeah.
I think he's affectionate to his parents, to his sister. Yeah.
He's a very loving boy. Hi. What's that for? No. No. Oh, I don't know why I did that. God.
I believe that all behaviour in autism is functional, and that a lot of what you see is actually because there's no other way that this young person or older has actually been taught or has learnt how to express what's happening for them. They actually don't have any idea about how their behaviour is impacting on you.
The kitchen. Oh, you've got a busy day at school today.
I've got 2 autistic children. Alexander is 7 years old and is in regular school, and Oliver is 5 and he's about to start school next year.
So, Mummy, can you look Madeline? Can you look at Madeline?
He was colicky early on as a baby till about 6 or 8 weeks. And then he thrived as a regular child until slowly the language development just decreased, and his eye contact decreased, and at the time we weren't aware of it until about the age of 2, and then suddenly we thought, he's talking a lot but not joining his words together.
And other things. Yeah, don't let him irritate you. Don't let him irritate you. Well, you know he does it on purpose.
I think the first autistic child I met, I felt positively offended by, because here was this child and I was trying to be nice and friendly, and they were just ignoring me. And I sort of, our natural human reaction is to actually feel quite miffed when somebody behaves this way towards you, and it's a totally inappropriate reaction, of course, from somebody who has a clinical understanding. But I think very often an autistic person does evoke a very negative reaction in other people, because we are used to having a good social interaction with other people, and if you have somebody who doesn't smile back at you when you smile at them, or doesn't look at you when you're talking to them, you don't just sort of feel, but you actually feel quite personally affronted. And once you understand about autism, you can put that to one side and see, now I've seen so many children with autism that you just sort of, they're autistic, that's fine. And you can talk to them and you realise that they can still indeed get quite a lot out of interacting with you, even though they might not be giving off the signals that you expect people to do. They might not be smiling back at you, they might not be looking at you. It doesn't mean that they dislike you, which I think tends to be the sort of reaction that we would naturally get.
And can you leave him alone?
No. Rohan cannot be left alone. Rohan's got to have someone to watch on him all the time. Yeah, we cannot sit down and do anything. We have to keep an eye on him all the time. I mean, like in the backyard, as I said to you, like he'll climb up the tree, or he'll climb the neighbor's place, So we've got to watch him all the time.
To merit a diagnosis of autism, there are these three main areas of function that have to be affected. One is your ability to communicate, and most children with autism are late in starting to talk, and then when they do, some of them never do, quite a high percentage of them never really develop functional speech. But other children do learn to talk, but quite often the way they use language is rather strange, and so they might use it in a rather stereotyped fashion.
Louder. You say no. Louder. No bigger. No louder. No bigger.
Another whole area is your social interaction, and perhaps that's the area that's most focused on difficulty getting on with other people, or really appreciating the need to get on with other people. Some children with autism seem to be uninterested in people and much more interested in things.
He's very obsessed at the moment. It's just with leaves. Yeah. So that's just the feel of them and just to twirl them. But he's very he only likes certain type of leaves. We don't know what type of leaves they are, but he seemed to know. Yeah. That's the thing. So sometimes when he wants a leaf, when we give it to him, he wouldn't want it. There's something about that leaf. So that's the thing. So it's very hard for us to understand what that is, but that's the kind of thing that he has, you see.
Again, in other cases, you might have somebody who's interested as they get older, perhaps would like to have friends, but doesn't know how to go about it, doesn't know how to perhaps read other people's facial expression or tone of voice, doesn't appreciate when somebody's angry with them.
My son was killed. He was 19. He was killed a couple of years ago by a very drunk driver. You mustn't drink and drive, folks. It causes lots of problems. We had about 300 people come to his funeral. And it was a really wet, windy day, just right sort of funeral atmosphere, just really grey. But all these people were outside, and we had Matthew in this coffin up front. And the kids had done a great job with decorating it with photographs, his brothers and sisters, and bits of paraphernalia that Matthew loved. But all these people were outside, so Wendy's trying to be really socially sensitive, use her intuition that it's not right that these people are outside and they're out in the weather, and they're here to celebrate that, Matthew's life. So I stand down in front of the coffin and I say, "Hey, everybody, he's dead, he won't bite. Come on in." All right? Yeah. Now I thought this was a good bit of wisdom. I delved into my monotropic understanding of what was the right thing to say, and I got it wrong. And if he screams or if he does anything silly, then people start to stare. That's the other thing. So that becomes a bit of a, and then my daughter gets embarrassed and she wants to leave. And sometimes he doesn't understand, he'll touch other people's hair and, things like that.
I've been very, very tactile defensive, and I don't like it when people touch me. And some of that is because it literally can be painful. Other times it's because the suddenness of someone coming in, I'm unsure what they're going to do. Or I've gone to the other extreme where I've wanted to stroke somebody. And unfortunately that's not allowed. You can't just go up to somebody who has the light shining in the back of their hair and start stroking their hair, because it gets you into trouble. I don't like skin touching skin, so I have to wear either pyjamas so that there's this divider between my legs, or I tuck the sheet down inside my legs so that the skin doesn't touch. And I know it might seem a bit strange, but it's very comforting too, actually. Yeah. And I am like many other people with autism, and we have a lot of sensory difficulties, so that sound can seem much louder, I think, sometimes for us. I used to hear the school bus coming way before other children did. I was up and ready to let you guys in yesterday when I heard the car pull up, and microwave bells actually can hurt my ears. Certain pitch and certain sounds are quite painful, and fluorescent lights are a nightmare. They're blinking all the time, and the noise from the motor, it's like a dripping tap. It's quite painful. I was in hospital with osteomyelitis. I had it quite severely. I was there for almost a year, and it came round to my 10th birthday, and the nurses came in with a cupcake with a huge white candle in the middle. They all gathered around my bed, and some of the other patients did as well. I was absolutely terrified. I had no idea what their gathering around my bed with this candle in this cake meant. So I hid under the doona, and I thought, if they think I'm dead, they'll leave me alone. And I tried not to breathe or do any kind of movement or any kind of response. And I laid still while they prodded and spoke to me and sang happy birthday about 3 times and called my name and whatever. About 10 minutes I laid still until they went away. And then a child would cough or someone would talk, and my attention was constantly being distracted.
She was a very difficult baby. Very, very, just a real high needs, high demand baby. Screamed a lot. Basically made our life very difficult.
This way, Georgie, this way.
2 children. A boy, Benjamin, who's almost 7, and Georgia, who's 4.5, basically. Yeah.
Well, we have a research study running here which is looking at the genetics of autism, and our real interest here is we know from previous studies that there is quite a strong genetic influence on autism, but nobody really understands how it operates.
There's cousins of George's that have, like ADD. There's history of depression on some sides. They say that, that can be a factor. I have a brother with dyslexia, and also a grandfather who I'm pretty sure was dyslexic, not diagnosed, but yeah, pretty sure. So there's definitely links there.
Are you going to walk nicely in the shop and be a good girl?
Yeah.
Going to be a good girl?
She screamed a lot for everything. We constantly were pulling into McDonald's just in the car because she hated the car so much, just to try and keep her quiet, feed her whatever we could to keep her quiet. She didn't sleep very well. She didn't like being held by strangers or anyone basically except us. It wasn't till probably about the 14, 15 month mark. She became really rigid in her behaviour and what was acceptable around her. If something was a little bit off to her, i.e. moving a couch around or moving something in her bedroom, those kind of things became more and more difficult for her to deal with from that point on, and they gradually got worse up to the point of her being diagnosed. Then it was out of control.
Quick. Walking nicely, good girl. Come on, quick, Daddy, come on. Quick.
Well, I remember how difficult it was to understand why we had to go out to visit relatives, go out to a shop, or whatever. Everything seemed to be like an intrusion for me. I'd be happily involved in something and we'd have to get dressed to go out. And I was very scared about this because I didn't know what going out meant. I didn't know if it meant we would stay out, would we ever come back in, clench my fists and take on a very anxious stance, really, and scream and carry on quite often because it was too difficult, too hard to understand.
Walking like a good girl. For a long while there, in the early days, we couldn't take her to a kids' party because she would freak when it came time for the kids to get together and sing happy birthday and bring the cake out. She'd just run with her hands on her ears screaming because of the level of noise and the activity from all the other kids. It was just a horrible scene.
What can you do with this? What can you do with it?
We're going to build a house.
Build a house? What a good answer.
She couldn't look, no matter if we grabbed her face, her eyes were darting, and she just was so terrified by it. So the time we got to the actual assessment point, she had deteriorated quite a lot from the time we were on the waiting list to when she was actually diagnosed.
Is that a relief?
Huge relief, yeah.
And a bit of a shock as well.
Yeah.
Because we didn't think she was in that realm.
We had just waited for so long for an answer as to what was wrong, and it was just a relief to have, even though a lot of people don't want their child labelled, a label was going to be a lot better than just being lost and not knowing what to do and whether what we were doing was right, how to discipline her. We just didn't have a clue, and all of a sudden there was support then, and okay, here's the direction you can take and here's what you need to do, and that's all we needed.
The teachers here have taught me that it's everything else that's going on in the shopping centre is affecting Eric too. The music, the noise, the people, which are things that we just take for granted. We just walk by and don't take any notice of it. But whereas the autistic child is taking everything in, and it's just too much for them to handle. But so I've learnt to understand the way that Eric thinks. He was actually on a waiting list on another place called West Ark, and he didn't get in there, so somebody suggested Uncle Bob's. We couldn't even communicate properly with Eric until we came here.
You finish. You finished. Good boy.
They have quite significant developmental delays, cognitive delays. They have sensory integration difficulties, obviously language delays. And what we're working on is looking at giving them functional skills.
I would roll a car down the passageway at home and he wouldn't even look.
You point at something you take for granted, to point something out. He wouldn't understand the concept of following the point, that you're trying to identify something to look at, or a pet that most children are warm to and run after. I mean, Jason just wasn't even aware that there was an animal there.
Come choose. Choose. Good talking. Choose. Come on, what do you want? There's a variety of children. The children come here sometimes for 12 months or 18 months or 2 years, and some children I've actually been seeing for longer than that.
Touch my head.
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 Put it there, man with the yellow hat. And all the children we have here are just, they're amazing. They're just incredible in their own little way. And I think that people get stuck on the autism label, and that they forget that if you put a group of 20 children in the room, they're all different because they have different personalities. Just because you put 20 autistic children in a room doesn't mean they're all going to be the same, because they bring different personalities to it completely. Yeah, and that changes them. They're quite fascinating. Well, I find them quite fascinating anyway.
Good. You're very clever at this game. Shall we do some more? Yep. All right.
In the UK, we just often talk of autistic spectrum disorder in much the same way. It's a rather loosely used term, but it's just used to refer to the fact that yes, there are many children who don't meet the core diagnostic criteria for autism, but nevertheless have problems similar in kind, and these are increasingly, I think, being recognised. Certainly in the UK, we're finding that I think as we get more sophisticated and sensitive to recognising symptoms of autism, that you can see that there are quite a number of children who have these similar sorts of problems.
As you know, on the spectrum, there's like Asperger's syndrome, pervasive developmental disorder, not otherwise specified, quite a long one, that one, and autism. To meet autism, you need to meet 6 criteria. PDD and OS is 4. So when Georgia was diagnosed, she met, I think, about 8 or 9 criteria. So therefore, she was definitely in the autism category.
Strictly speaking, pervasive developmental disorder is a sort of umbrella term that includes autism, but also includes some other, much rarer developmental disorders. But in practice, it's tended to be used as a shorthand for an even more horribly complicated word, which is pervasive developmental disorder, not otherwise specified. Also known as PDD-NOS, this was invented in America, where else? And it's not, I must say, a very popular diagnosis in the UK, where I come from, where most parents just couldn't cope with all those words and would wonder what it meant. But essentially, this is a label that was invented originally because people were aware that there were children out there who looked somewhat autistic but didn't meet the full diagnostic criteria.
The spectrum of any disorder goes to the edges of where people are impaired. Beyond that, there may be human characteristics that are a bit like it but don't cause problems in a lot of situations for most of an individual's life. So people say, oh, you're a little bit autistic, you're a little bit spastic, you're a little bit hyperactive. And that's one of the difficulties about developmental and behavioural disorders, that they are descriptive. So that there is often a difference in a point of view between where the edges of the spectrum end.
Yeah, a lot of people still have the view of, oh, autism, oh, they're really smart, aren't they? And it's such a small group of those kids or people that are diagnosed that have a high IQ. Around, I don't know exactly what the figures are, but I think it's around 50% of kids actually have an intellectual disability as well as autism.
When you tell them that your child is autistic, you know, they ask you, you know, what's that? You know, what's autistic? That's what it is.
What?
So
you tell me what you want.
know, and sometimes, you know, some of them who do know, they think your child is like Rain Man. You know, or your child must be good in music. You see?
I'm so glad that this is the era that she's been born in, and that we have a child to deal with autism in, because back, you know, even 10 years ago, there wasn't early intervention. Like in Perth, it's only been the last 5 or 6 years that early intervention has been funded and, you know, recognised through disability services, and they fund it. So, you know, it's only been a recent thing. If she didn't have that, she would have been a child that everyone just gets, and she'll be all right eventually, just leave her. You know, she's got a bit of language, let it go, it'll happen eventually, and all those behaviours would have just been stuck.
What happened for me at the age of about 17 was, in fact, my autistic behaviours seemed to increase, and I started talking out loud more to myself, finger flapping in front of my eyes, and hand flapping increased. Doctors said that I was having psychotic experiences, and they took me to a psychiatrist. I'd actually attempted suicide 2 or 3 times as well, because I didn't really see much point in staying in the world when I couldn't understand it. I went to the psychiatrist, and he said, when did you hear voices? And I said yes, thinking, silly man, you don't see voices. You know, everybody hears voices. That's what voices are meant for. You're meant to hear them, and then you can respond. And he said, yeah. I said yes. And then he said, what do these voices say to you? And I said to him, well, it depends on whose voice it is. And he said, oh, you hear more than one then? So he wrote down that I have auditory and visual hallucinations, and gave me a diagnosis of schizophrenia. And then I was put into an institution and given large doses of antipsychotic medication. And I had lots of antipsychotic medication over many, like 25 years after that, and was in and out of institutions often. It was extremely terrifying. It was very scary. Yeah, it was. I never felt at home with that diagnosis, and I don't believe it was accurate. I think, looking back, I didn't have a diagnosis of autism then. I had a diagnosis of intellectual disability, which was given to me as a small child. And then I got this diagnosis of mental illness, schizophrenia. I didn't get my diagnosis of autism until August 1994. I think it's really important, having this picture of yourselves, you then get a mirror picture of how people with autism are actually designed, how we're put together, remembering it's not one size fits all, remembering that people with autism are also individuals.
their own personality, their own upbringing, gender, age, all the things that make you you make us us. So there's going to be a very definite stamp of difference on everybody. Not all little kids with autism are in the corner flapping bits of paper. Not all kids with autism bang their heads and nibble their knuckles. Not all kids with autism will grow up and be engineers, but some will.
Most people in the field feel now it's going to be a complicated interaction between a genetic predisposition and certain things in the environment that might then interact with that, and there might be environments that are particularly bad for you if you're autistic.
There is some research that would seem to indicate that the incidence is increasing. On the other hand, there's other research that says, it's not increasing.
When you look at our waiting list, it's criminal that these children sit for so long on waiting lists everywhere, that a parent goes for an assessment and then the horrible realisation that their child has a difficulty and a lifelong difficulty for many children, and then they sit on a waiting list for a year or 2 years.
Well, we certainly don't know what aspects have gone wrong to cause autism. I mean, because just certainly looking at the brain in terms of things like relative size of different regions, you can't see anything obvious or gross if you look at the brain of somebody with autism.
And you can choose something else. What's that? Give it to Paige. Nice chair, eh? Stop and use your words. Tell me, what do you want?
Well, there's no autistic centre in the brain, that's clear. There are, in terms of the structure of the brain, a few differences one can find on MRI scans and things like that, but they're not specific. They can occur in a whole range of developmental problems.
We think that what happens in autism itself is that maybe you can have genetic characteristics that perhaps push you more in the direction of being somebody who's more interested in things than people, or somebody who's capable of being very focused rather than seeing the bigger picture. And we're really interested in this study of trying to look at people with autism and their relatives to see whether we can find genes that relate to these particular characteristics.
Is there any thinking that there are certain triggers then that would trigger that gene into action?
I think that's a very interesting possibility.
The nature of autism, described throughout the time we've ever known it and given it a word, is that some individuals, not all, and only the minority, that some individuals are normal, and something happens in the brain in that first or second or third year of life that social reciprocity switches off or doesn't develop, language disappears, and of course that's dramatic. And within the world literature and the expertise of people in the world of disability, all of us know some stories where there seems to be an event. But that's how people remember it in prospect.
I'm going to bring my clothes over here.
No, let's put them on. Come on.
The triggers were different with both the children. I do believe that fairly much across the board, a lot of autism, there's a genetic predisposition and then there's an environmental trigger. In Alexander's case, I do believe the triggers were most likely was vaccinations.
Put your shirt on.
I'm not convinced that's what affected Georgia, but by the same token, she did progress normally as far as what we discussed before, developmentally, right up to that 12, just after that 12, between 12 and 18 months, where you have the MMR. So I don't believe that autism is caused by immunisation, but I think if you have a genetic predisposition, that maybe it triggers it. That's my view on it, and that's obviously a very contentious issue.
I think that the real difficulty is once an idea gets out there, it's very hard to get rid of it. And certainly in the UK, I remember I was listening the other morning on the radio on our Today programme, which everybody listens to first thing in the morning, and somebody was calling for a public inquiry into the link between immunisation and autism. And the scientists that they had to respond to that said, well, we've had 3 or 4 inquiries. You know, the Medical Research Council has set up an inquiry. There have been a number of thoroughly reputable bodies looking at all the evidence, and there have been now a number of studies very solidly looking, you know, comparing children who've had immunisation with those who haven't, studied done in Finland. So there is absolutely no evidence, but nobody's going to believe us.
Jason, come and sit down. Stand up.
Well, they may be disposed to some sort of environmental insult, but there seems to be the conventional view that you're born autistic, and rather than something in the environment triggering a problem, and that perhaps if you can identify that cause, then you can treat it.
Okay,
Are you do up my buttons?
Oliver, on the other hand, I believe, again, probably had a genetic predisposition, but the trigger was definitely, I think, antibiotics. And once we started trying to reverse that, you know, Oliver's improvement was quite rapid.
So clearly we need to pursue these issues, we need to take them responsibly, we need to listen to people's concerns, but a lot of these issues are by association, and that's always a hard thing in medicine, by association. And there isn't really very strong evidence that's reproduced in a number of centres and different populations for most of the theories. Doesn't mean we shouldn't pursue them, it doesn't mean we shouldn't be serious about investigating them, but it does mean that we have to tell parents, sorry, there isn't a whole lot of knowledge about that.
I think one of the first things the government needs to do is start keeping records of the numbers of autistic children. You know, it's very frustrating when doctors keep saying, oh, there's no evidence that it's really epidemic proportions. We think it's anecdotal. Well, it's epidemic proportions in every other country in the world where it's documented. But the Australian government has not kept records of the number of children being diagnosed with autism.
It is entirely possible that the epidemic isn't really an epidemic, it's just recognition of a wider range of children. But we don't know because we don't know what, you know, we haven't got the comparative statistics from 10 years ago when these children just wouldn't have been recognised.
The issue about the rates of autism is reflected in our knowledge of all the other disorders, as I've said earlier. We are more aware of the range, the spectrum. We are more aware of having to give a label to get people help. I will call people autistic who aren't really, because they will get special education that they need to function better, and that's what society should be doing. It minimises their cost to society later.
At the moment he only gets about 5 hours a week, and I know for a fact that they've got a huge waiting list for children that don't have anything, and if there was funding, it would really save the government a heck of a lot of money later on, because this is the crucial time. The brain is still tender, they're learning heaps.
The cost to get someone to come out and to work with him is quite high. You know, we really struggle to find the money to give him that sort of help, but we need to do that in order to give him.
Sorry. But how long can you provide that? That's the other thing.
Put on. You're going to do 3 more.
Well, in some areas, yes, he has improved. Because when Rohan started the Stepping Stones program, he was completely non-verbal. He had no words at all.
Giant Step Sydney is a multidisciplinary intensive program for children with autism. We offer individualised programs for children across the spectrum, offering individualised educational programs as well as therapeutic intervention.
From first day he just ran in and was really happy and responded well to the therapies.
Bye, Alexander. Say bye. You can say bye, Oliver. Bye.
If you have a child whom you think even suspect has an autism spectrum disorder or is anywhere on that, even language delay, intensive work with young children just pays off so much better. And I know of children whom we see that we get in at 3 and 4, and we have siblings who are coming along who unfortunately may have an autism spectrum disorder, may not. They've benefited so much more greatly from being taught from 2 years onwards, and their potential is just unlimited if you can tap into it. But if a child sits on a waiting list until they're 3 or 4, until we have a vacancy for them, it's wasted time. It's such precious time, and you don't get it back. And that's the thing. People say, oh, look, next year, he'll get in next year. But if you don't get when they're young, it's just all lost. And it's not that you can't get it back, but it's just so much harder. Behaviours become entrenched. Language, if they have language, becomes really entrenched, and it's hard to move them on.
She's gone from a little girl who was significantly disabled in so many ways, socially, communication, everything, to a little girl that blends in fairly well. To the average person, she would probably just appear really shy. She's classed as having autism. Whether she would be, it's unlikely she would meet those criteria now, 18 months later. Being an early intervention for 18 months, we've been very fortunate, very lucky. I shouldn't say lucky because it's been really hard work, but she would probably be reassessed at 5, and it would be unlikely that she would meet those criteria.
There's no certainty out there and there's so much controversy and debate, and where can you get advice? I mean, Australia is fortunately the internet has been a wonderful resource that for parents that preceded us that didn't have access to information like that, we know what's going on, virtually cutting edge research, and we can, to a certain extent, we can pick up on it.
And there's no quick fix. You know, it does need to be, as I said before, you know, looking at all aspects of the child, and nutrition is a really important part of it. That gets the body and the gut and the immune system back in order, then the child's in a better place for learning.
Started the morning concoctions. In the United States, where they were simply looking at the gluten-free, casein-free diet, and they had tracked the development of children on the diet and children not on the diet. And, you know, I'm not a statistician, I haven't taken their studies apart with a fine-tooth comb, but essentially it showed that there was a substantial gain, you know, in the children who were on the diet.
Use the fork.
We try and follow a sensible diet by trying giving him less sugar when we can, and try not to give him much, you know, like food colorings and things, which I think is quite sensible, which is something that anyone would do. But to really go into the diet deeply, I think one's got to be really prepared.
I actually mix up my own version of like gluten-free cereals, mainly because the cereals are fairly bland in their own right, so I get different textures and flavours and put them together. So it changes every week depending on what's in the box.
I think diet may not be the answer for every child with autism spectrum disorder, but certainly from my own personal experience I've seen a number of children who have just, you know, blossomed as a result of being on systematic dietary intervention.
We know there have been complementary medical systems for thousands of years, and it would be marvellous if they worked. And it's wonderful if parents see a certain dietary manipulation improves their child. Of course people will want to cure it. I'd love it if there was a diet I could give for all the children I see, but there isn't. All I can do is give support and the basic understanding of current knowledge and say, well, let's first do no harm and look at it sensibly.
I mean, having a child like Rohan, you know, who has such high, you know, support needs, he needs to be attended to most of the time. And if I spend my time looking into what I can bake, which is gluten-free and this and that, I think I won't be able to. I mean, it'll all be too stressful for the whole family, you know what I mean? I think it takes a very special couple to be able to stick together and, you know, to try and bring up a child like, you know, like Rohan and, you know, any kind of children who've got high support needs, I think. Or any kind of, isn't it, disability, I would say. So I think it gets a very special couple. It is a lot of hard work.
Some nights Nick comes home and he doesn't get dinner because I've spent all afternoon cooking a separate meal for Alexander and a separate meal for Oliver, and I'm like, oh, what are we going to eat? But it is incredibly demanding on personal relationships.
It was difficult. It was very difficult in the fact that, at that time I was working 9 to 5 in a 9 to 5 job, so I could walk out of the home from any problems and come home at 6 o'clock at night and not have to deal with them. But I come home to Deb, who had been dealing with the behavioural problems of
crying on the kitchen floor.
Yeah, basically a shattered mess most days.
Oh, it has been, and we're church going, but we even found the pressures there that we felt embarrassed because our child, we can't control our child, and people don't understand why he can't understand a simple instruction and he can't settle, and so it is very distressing, and you do feel cut off from the rest of society because obviously it's still a minority illness and most children are normal, and of course you feel exceptional, and that's a centre like this you do. The other aspect is that we do feel a sense of comfort and acceptance that there are others like us, and the people, the staff here are so supportive and they give you hope.
Parent-to-parent support and established parent-to-parent support is one of the key factors, I think, that parents need to be linked into just to keep them sane in some ways. And it's good, and they can also share their successes, so it's not just all negativity. But when you go and visit someone's house, like some of our parents visit each other's houses, it's lovely because you don't have to explain your child to that person either.
I've got a 21-year-old autistic son. He's got one word he's coming out with. It's with females that he knows, going up and getting eye contact and saying, "Sex, please." Yeah. So what do we do? Yeah. He can't tell us what he wants, but
he probably wants sex.
But he can't.
I was performing at my talk. It's a lot easier for me to get into role and be on stage and perform a particular given role of presenting, educating people about autism than it is to talk one-on-one situation or in a group where there is all the waves. I find being in a city where there are lots of traffic, lots of people, lots of movement, very difficult because I'm not sure where to direct my focus. If I want to... the waves are splashing, which is absolutely wonderful. I live in Warrnambool, which is the largest town on the southern coast of Victoria in Australia. We have beautiful seabirds, and the whales, the southern right whale in particular, come to Warrnambool. We have a bed and breakfast unit that I think is particularly autism friendly. Families with autistic children can come and have a holiday. I travel all over, not just Australia but Europe as well now, and talk to teachers, parents, social workers, psychologists, anybody that has any interest in understanding autism. I didn't have a place, I couldn't work, I've never had the ability to hold down a job. Do you know that's a bit of a metaphor? Do you know what that means? Yeah, keep a job. I've not been able to do that, but whereas now I feel I have a job. I can write, I can teach, and it gives me a great feeling of being useful or something like this. It does heaps for my self-esteem. Yeah.
different people because of what we've experienced. I'm so much better as a parent than what I would have been had we not been through this.
He's 4.5 and hasn't acquired any language. He's got the picture-based language to communicate sort of basic needs, but a lot of children, autistic children, apparently do develop late. We haven't given up on him.
I've learnt to understand the way that Eric thinks, which is a great help, and my family's the same too. They can have a better understanding of autism now, which is just great.
In the last 3 or 4 months, he has just made my heart surge because he's just been so much happier in his own right. From here on in, I think a lot of Oliver's future depends on how he takes it. It's looking very bright.
He used to be much more aggressive around last year and the year before. He used to constantly pull my hair and, you know, and hit me and things like that, but it is starting to get better now.
In the next 5 years, I would really like to see understanding of autism grow in the wider society. And I want the world to understand. So if in the next 5 years we can make some steps to gaining that understanding, so that as our children grow up and they engage in the world that they're living in, they're not misunderstood. And that's what I would like to see. I've got a dictionary of metaphor I'm writing at home for people with autism, which is it's quite interesting because you can explain, no, when he says pull your socks up, mate, he doesn't mean bend down and pull your socks up. And the little person says, well, why does he say it then? It's a metaphor. It's a metaphor. You go to the cinema, you watch a brilliant movie, you cry your eyes out. That's a metaphor. And you ring a mate the next day and you say, oh, I watched this beautiful movie, I was moved, even though you didn't leave your seat. I have whole villages that don't talk to me. And I'm serious. I've upset lots of people. I've had that I thought were firm friends, and I had one lady, in fact, say to me, I would love to be a friend for you, someone who's available to you and to help work on particular things I was having problems with. So I rang her up at about 3:30 one morning. In England last year, I got to an event 3 hours ahead of time because I get worried about being late. I waited 2 hours and then left because I waited long enough. You know? This timing thing that you seem to have an innate understanding of, I find really hard.